Hi, my name is Jordan Korfman, and I'm going to be presenting on the foundations of public health. Public health is a discipline that very powerfully shapes the health of entire populations. This presentation is going to explore the foundations of public health, which includes its philosophy, values, historical evolution, and also future direction. Rather than focusing on treating illnesses after it occurs, public health very strongly emphasizes prevention, equity, and systems level solutions. Throughout this presentation, I'm going to integrate different concepts that have been learned throughout this course, which include social determinants of health, health equity, the public health system, which is going to demonstrate how public health improves lives at a local level, a national level, and even a global level. I first wanted to begin with a presentation overview. This presentation is going to begin with a clear definition of public health and an explanation of its guiding philosophy and its core values. I'm also going to discuss how social determinants of health often influence different outcomes and why health equity is very essential in improving population health. Following this, I'm going to examine the roles of governmental and non-governmental institutions and help to explain the three core public health functions and different essential services in this field. The presentation is also going to review certain key historical milestones and achievements, along with identifying current challenges, and then conclude by discussing the future of public health practice. Before I move forward, I just wanted to emphasize the importance that public health is inherently interdisciplinary. This means that it draws from fields like epidemiology, sociology, economics, and different environmental sciences. And this approach allows for public health professionals to address complex health problems from multiple different perspectives rather than just relying on one single solution. This is a system-based way of thinking that is very much reflected throughout the topics discussed in this presentation. To begin, I wanted to start with going over the question, what is public health? Public health can be defined as the science and art of preventing disease, prolonging life, and also promoting health through organized efforts of society. This differs from clinical medicine, which places a high focus on diagnosing and treating individual patients, whereas public health focuses on populations as a whole. Examples of public health activities can include vaccination programs, health education campaigns, disease surveillance, sanitation systems, and policies such as seatbelt laws. By addressing risk factors before illness develops, public health is able to improve quality of life and also reduce healthcare costs. In addition to this, public health takes a proactive approach to health protection. This means that rather than waiting for an illness to occur, public health really seeks to identify different risk factors very early on and intervene at the community or population level. An example of this can be seen through policies like fluoridation of drinking water, motor vehicle safety laws, and workplace safety regulations, which have prevented countless injuries and even deaths. These interventions often operate in the background, which is why public health success can go unnoticed, despite its very, very large impact. It is very important to understand the philosophy of public health when looking into this field. The philosophy of public health centers on prevention as the most effective way to improve these health outcomes. Preventing disease often reduces suffering, it can save lives, and also lower healthcare expenses. Public health also recognizes that health is not only determined by individual choices, but is also determined by different social, environmental, and economic systems. With this being said, improving health requires a collective action along with policy interventions and evidence-based decision-making grounded in scientific research to accomplish this. When looking at public health, there are some core values that are associated with it. These core values are thought to guide the field of public health, and these include social justice, health equity, ethical practice, and community engagement. These values place a heavy emphasis on reducing health disparities and also prioritizing vulnerable populations. Ethical public health practice can seek to balance individual rights with the responsibility to also protect community health. Factors like transparency, accountability, and respect for people are very essential components of ethical public health and in decision making. Another important core value is accountability to the public. Public health professionals are often responsible for using different resources very wisely and making decisions that are transparent and also based on scientific-based evidence. Community engagement can also be essential, this being that successful interventions require a certain level of trust along with cultural understanding and a value on collaboration in general with the populations that are being served. These values are very important, and without them, even some well-designed programs could fail to achieve a meaningful impact. In this field, there are also factors called social determinants of health. Social determinants of health are thought to be the conditions in which people are born, grow, live, work, and age. These factors can include income, education, access to healthcare, housing equality, transportation, and social support. Research has consistently demonstrated that social determinants can account for a significant portion of health outcomes, sometimes even more than medical care itself. Due to this, understanding these factors is essential when designing effective public health interventions. Continuing on with this, of the importance of social determinants, these consider how access to transportation can affect health. Individuals without reliable transportation may often miss different medical appointments, they can struggle to access food, and they may even experience delays when in emergencies. Similar to this, different neighborhood safety influences can affect physical activity and mental health. These examples show how health is shaped by daily living conditions as opposed to just healthcare services. Social determinants of health very strongly influence patterns of disease and life expectancy. Individuals that live in poverty often experience higher rates of chronic disease, infant mortality, and even premature death. Education can improve health literacy and access to employment opportunities. Things like safe housing and clean environment can reduce exposure to environmental hazards. Structure inequities, which can include racism and discrimination, can further these disparities across generations. Social determinants also operate the life course. Early childhood experiences, such as access to quality education and a stable housing, have long-term effects on the health that this child would have in adulthood. Different conditions during childhood can increase the risk of chronic diseases later in life. And addressing these determinants early is one of the most effective long-term public health strategies. Moving onward, we're going to be looking at what is health equity. Health equity refers to the attainment of the highest possible level of health for all people. This involves eliminating avoidable and unfair and overall just unjust differences in health outcomes by directly addressing systematic barriers. Health equity recognizes that equal treatment does not usually or always promote the same outcomes, and that different populations may require different resources and different supports to achieve similar levels of health. Health equity also requires measuring and monitoring disparities over a period of time. Public health agencies often use data to identify which populations experience poor outcomes and to evaluate whether interventions are reducing gaps. This is a data-driven approach, which helps to ensure accountability and also helps guide resource allocation towards communities with the greatest need. When looking at health equity, can also align with a Christian's perspective. From a Christian perspective, health equity can align very closely with different principles, which include principles of justice, compassion, and the dignity of every person. Within the Bible, it very repeatedly calls for people to care for the poor and the sick, along with the marginalized. With health equity and promoting equitable access to healthcare and good living conditions can be a reflection of the moral obligation many have to love one's neighbor and also to steward health as a sacred responsibility that has been given to us from God. Different faith-based organizations have historically played a very vital role actually in advancing health equity. Different hospitals and clinics, along with different outreach programs, were often founded by religious groups that were committed to serving these marginalized populations. This tradition continues today through a faith-based public health initiatives, which often addresses physical, emotional, and spiritual well-being alike. In public health, there are many different government roles within this field. Different government agencies can play a very central role in protecting population health. These responsibilities include creating and enforcing health policies, along with conducting disease surveillance, regulating environmental hazards, and coordinating emergency responses. Governments also tend to fund public health infrastructure and programs, which ensures that essential services such as immunizations, sanitation, and outbreak response are available to all communities alike. Government agencies also play a very critical role in protecting health during emergencies. This can be seen in different pandemics, natural disasters, and bioterrorism events. Through coordinated responses, clear communication, and evidence-based policies, these are essential for minimizing harm and also maintaining public trust during these crises. Along with government roles, there are also many non-government roles that are very important in the field of public health. These non-governmental organizations can include nonprofits, different faith-based organizations, academic institutions, and also private sector partners, which often work together with these governmental efforts. These organizations very often work very closely and directly with the communities and can provide culturally appropriate services along with conducting research and also advocating for underserved populations. The collaboration between governmental and non-governmental sectors works together to strengthen the overall public health system. These non-governmental organizations also can serve as innovators to public health. They often help to create new programs and respond quickly to different needs that are emerging, and they also advocate for policy change. They have a lot of flexibility, which allows them to reach different populations, which might be hesitant to engage with these government agencies, but feel more comfortable with the non-governmental ones. The field of public health and this practice is often organized surrounding three core functions. These functions include assessment, policy development, and assurance. These functions provide a structured framework that guides public health professionals in identifying different health problems, also in developing evidence-based solutions, and ensuring access to necessary services in public health. To dive in deeper on these core functions, I wanted to begin with assessment. Assessment involves collecting and analyzing data to monitor public health and also to identify emerging threats. Moving on to policy development, this uses information in order to create different strategies and laws that can help improve health outcomes. And lastly, assurance can ensure that these policies and programs are implemented effectively into those communities and also ensure that they have access to quality health services delivered by a competent workforce. When looking at the field of public health, there are also some essential public health services. These services help to operationalize the three core functions. These services include aspects like monitoring health statuses, educating and empowering communities, mobilizing partnerships, enforcing health laws, and also evaluating programs. When put together, they help to define the activities necessary for a strong and responsive public health system that is effective. It is also important to note that the essential public health services can serve as a framework for accountability. These help to allow communities and agencies alike to evaluate whether public health systems are functioning effectively or whether they are not. Through regularly assessing these services, public health organizations can help to identify gaps, improve performance, and also help to ensure that resources are being used efficiently to protect the population health. When looking at the history of the field of public health, there is a pretty extensive history that comes along with it. It's important to look at the early foundations, considering that public health has some pretty ancient roots. Early civilizations helped to develop sanitation systems and also recognized the relationship between environment and health. Moving onwards, Hippocrates actually emphasized the influence of air, water, and place and how they have an effect on disease. During different plague outbreaks, quarantine practices have been implemented in the past to help limit disease spread and also representing early organized public health interventions. The development of public health accelerated during the Industrial Revolution, when overcrowding was a problem, along with poor sanitation and very unsafe working conditions, all led to different widespread diseases. These conditions promoted early reforms in housing, labor laws, and sanitation laws, which was marked as a turning point in public health history. Throughout time, there have been some very major environmental health achievements. These are considered to be among the most impactful in public health history. These include clean water systems, proper sewage disposal, food safety regulations, and also air quality laws. All of these achievements have helped to dramatically reduce infectious disease and also have helped to improve life expectancy as a whole. These achievements can highlight the power of the preventative population-level interventions that do take place in public health. When viewing all of the achievements that have taken place in public health, vaccination can be described as one of the greatest successes in this field. Vaccinations have led to the eradication of smallpox, the near elimination of polio, and also dramatic reductions in measles and different infectious diseases like this. Immunization programs have continued to prevent outbreaks and also help to protect very vulnerable populations through this herd-like immunity. Vaccination programs not only protect individuals, but can also contribute to the community as a whole, which helps to protect those who may not be able to be vaccinated due to age or different medical conditions. This collaborative benefit helps the ethical foundation of public health, along with the importance of widespread participation to help eliminate these factors. Another achievement in the field of public health can be seen in tobacco control. Public health efforts to reduce tobacco use have included education campaigns, along with producing warning labels, implementing smoking bans, and also implementing taxation. These interventions have actually very significantly reduced smoking rates and have prevented millions of premature deaths due to this. Tobacco control demonstrates how policy, education, and environmental changes, just how greatly they can influence health behaviors at the population level. These tobacco control efforts also reveal how public health strategies can evolve over time. A lot of initial education campaigns were later strengthened by policy measures, like advertising restrictions and smoke-free laws, which demonstrates the value of combining education with regulation in this field. When looking into the field of public health, it's important to see a timeline along with different key events and milestones that have taken place. Considering that these public health milestones can span for centuries, from ancient sanitation practices to modern epidemiology and the global health initiatives that take place. Some key developments have included the discovery of germ theory, advancements in epidemiology, vaccine development, tobacco control efforts, and also an increasing focus on health equity and global collaboration. You can see here that starting from centuries ago, there has just been continual efforts to continue to improve public health and health for communities in general. Though there are many public health achievements that have taken place, there are also some current challenges. Public health today faces different challenges, which can include misinformation, workforce shortages, persistent health inequities, climate change, and also the emerging of different infectious diseases. These challenges place a really heavy strain on public health systems and can also show the great need for adaptive strategies, along with strong leadership and public trust. And a very important one in this is misinformation, particularly through the emergence of social media, has become a very significant public health challenge. False information can very likely undermine this trust that is needed, which reduces adherence to health recommendations or even worsens public health outcomes. Addressing misinformation requires very clear communication, transparency, and engagement with trusted community leaders in public health. When looking into the field of public health, and especially when viewing the challenges that are present in today's society, it's very important to address these challenges and to move forward in a positive way. Addressing these challenges can require strengthening community partnerships, investing in public health workforce, improving science-based communication, and also leveraging data to guide decision-making. It's important to have collaboration across healthcare, education, housing, and environmental sectors, and this is essential for sustainable population health improvements and going forward from here. Moving onward and looking at the public health practitioner of the future, this was process systems thinking, data literacy, and cultural humility, along with ethical leadership and strong communication skills. These competencies are very critical for responding to different emerging threats, very critical when addressing inequities, and also working effectively with diverse populations. Future public health practitioners are also required to be adaptable and resilient. An example of this can be seen through the COVID-19 pandemic, which really highlighted the emotional and ethical challenges that are often faced by the workforce, which emphasizes the importance of leadership, self-care, and organizational support in this field. When viewing the future of public health achievement, it's important to see that in the next 25 years, one of the most significant public health achievements may be seeing a measurable reduction in health disparities. Advancements in data analytics, technology, and also global cooperation can offer the potential to design a more precise and equitable and also just effective public health system overall. To conclude, public health is a dynamic and essential field which is grounded in the prevention, equity, and collective responsibility. It has some historical successes that help to demonstrate the effectiveness of this population-based approach that it takes. When looking at this, continued commitment to public health principles are essential for improving health outcomes now and in the future generations. as public health continues to evolve, its success will depend on factors like maintaining public trust, adapting to emerging health threats, and also prioritizing equity in all policies and interventions. When looking at the past, there are some lessons learned, and looking at these successes, there are also lessons learned that can help provide valuable guidance when shaping a healthier and more equitable future. These are my references, and that is the end of my presentation on the foundations of public health. Thank you so much for listening.